to the
Hi
last
there,
week, and
latest
now we've slightly
up-to-date
overtaken them. I think what's driving it
coronavirus
is
UK
BA2, the
video,
sublineage of Omicron,
UK
which we know is
2022.
about 30% more transmissible even than BA1. And in fact, you're seeing around the world, I think about a significant increase in cases, around 11 million cases reported by the WHO this week, and around 99% of those sequenced around the world are Omicron, but BA2 is the main reason for this. And I think we have more of that variant than some regions of England, for example, the Northeast. I think there's maybe a sign we'll see that things could level off soon. We've seen that in Denmark. They had a huge surge of BA2 that's now gone down, but it's obviously a concern mostly because it's driving a lot of infections, which then means people are absent from work, and also we have had more people admitted to hospital, but that seems to be the main explanation.
Chris, just pick up on that, and Linda's gone through some of the figures for us. A lot of people were thinking, what about the pressures on hospitals? So, how do we equate what's happening now if there's a rise in cases, which is the suggestion, with how concerned we should be?
A few things to bear in mind. One of them is that most people are going into hospital now with something else, and COVID is being picked up incidentally. We think 2/3 to 3/4 of cases of hospitalisation, cases of COVID, aren't people in hospital because of COVID, they're there with COVID. And that reflects the fact that a very high rate of COVID is spreading around the country. So people are going to continue to have heart attacks, have strokes, fall over, break their hip and so on. So they need to go to hospital. But because there's very high levels of COVID in the community, unsurprisingly, when they come into hospital, we're finding them and testing them as positive. But the underpinning thing, and the thing to bear in mind, is it doesn't take very many cases of COVID to really seriously disrupt our ability to deliver a healthcare service. Because the measures we have to take and the lengths we have to go to control outbreaks in hospitals and keep people safe means that it doesn't take many cases of COVID and we've got very little room to manoeuvre. It's a bit like having a car park where the car park has one free parking space and you've got cars going round and round and round all over the car park trying to find that one free space, and then you're trying to manoeuvre a really big car into a tight parking space. And that's how we're currently running the NHS, with very, very high rates of bed occupancy, very little room to manoeuvre. So when you do get a few cases of something like this, even a few, it then causes a domino effect that disrupts the service. And this is something we must think about for the future, as we've got this respite coming over the summer. The sun's coming out, as Chris Whitty and Patrick Vallance dubbed it. We need to use that time to have a plan for the autumn to make sure we don't end up in such a bad way again in the future.
Linda, can I get one of our questions from one of our viewers, from Martin? He wants to know, how can we have reliable statistics on infection rates when many people are not registering their positive lateral flow tests? Because, of course, we don't have to do that anymore.
Yes, so I think Martin's right. The cases are not as accurate a picture of what's happening in the country anymore. That's absolutely the case, and that's why we need to rely on things like the ONS infection survey, which is a sample of people around the country. They're regularly swabbed, and you can look at what's happening in the community. I think that even in Scotland, we've seen a decline in testing. I think a number of weeks ago, sort of the middle of January, we was about 160,000 was the sort of 7-day average. It's now just over 100,000. And of course, from April the 1st, free asymptomatic testing will end in England. It's being continued a bit longer in Wales and Scotland. What we need to do, therefore, is keep these population-based studies going. They're vitally important, and we need to keep that for the longer term, in my view, not indefinitely, but for some time to come. And then I think we also need to focus on the changes in testing and recognize that we will still have some PCR testing, particularly for those who are at risk or become unwell, i.e. in hospital. And that's important because we can't genomically sequence the virus and find variants from lateral flows. We can only do that from PCR. Of course, people will be able to buy their own lateral flow test, but that is also controversial because perhaps the people who need them the most won't be able to afford them. So it is a big shift, but it's an expensive program. We're moving ahead, and we need to keep the capacity for people who are unwell. That's certainly what the government is arguing.
Chris, pick up on this question from Karen, and I assume Karen's speaking from personal experience this question. COVID is still ripping through schools. That's a statement she's made. I mean, maybe you've got some thoughts on that one, and then goes on to say, do you think every classroom should have an air filter system? I know that's something we talked about a lot in the early days of the pandemic?
Certainly, many people are reporting that they have lots of teachers off at the moment with COVID, but then that's true across all industries because we are seeing very high levels of prevalence in the community. As we were hearing at the beginning of this piece of the programme, maybe one person in 20 or fewer, a lower number than that in some parts of the UK. This is certainly focusing minds on what we have to do to try to keep people safe, not just from COVID, but from a whole raft of infectious diseases in the future. Before COVID came, we were losing millions of work days and school days per year because of ill health. A lot of those cases of ill health were cases of transmission that occurred in the environments that people live in, work in, and travel in. And so an obvious intervention to make us all healthier in future is to look at that and say, well, what can we do to try to minimise those risks going forward? And certainly places where people congregate, gather and spend lots of time together are hotbeds for transmission. And so we really do need to have a plan, not necessarily this week, but for all the weeks in future to safeguard us all by improving those sorts of things, including better ventilation in workplaces, on transport, and in classrooms.
Agreed.
And air filters can make a very big difference. We've got some very good data from my hospital where we installed some of these filters and measured the amount of viruses in the air, and it makes a dramatic difference, actually. We were sceptical when we installed them, and we were very surprised by the results of how good this appears to be. So I think that this is something to bear in mind for the future, definitely.
Linda, I imagine, we're always looking back, and whatever situation you're in, you're looking back and thinking, what could we have done better? And you know that the strategies of various governments have come under intense scrutiny. China had this zero COVID strategy, testing, mass testing, and yet for the first time since January last year, it's reported 2 deaths from COVID. That zero COVID strategy, is it too early to say it doesn't work, or that COVID is inevitably going to get into the community?
Well, I think the zero COVID strategy that a number of countries pursued, let's use New Zealand as the one example we've mentioned many times on your programme, definitely had benefits in the early days of the pandemic. Look at the mortality rate there compared to elsewhere. They have geographical advantages as well. And what they did is they waited until they had a very high vaccine uptake before they opened up. You'll have seen people now soon will be able to travel to New Zealand, if not already some people. But a tough time for that country, but they've saved lives. China is continuing to pursue that policy. New Zealand has abandoned it. It's got a highly vaccinated population. The big challenge for China is that vaccine uptake in older age groups has not been as high as we would wish. And we've seen that in Hong Kong, where there's been really high death rates because of unvaccinated older groups. I don't think a zero COVID strategy is sustainable. What is causing real concern about China at the moment, particularly given everything else that's going on in the world, is if we have major disruption to supply chains, we have bits of China that are cut off because of cities locked down. It has other economic impacts that are deeply worrying. So I think China will have to consider how it proceeds in the longer term. And like everywhere, the route out of this is to roll out vaccines that are effective and that will reduce mortality while recognizing that we will have infection in the community because the virus isn't going away.
Linda, always good to see you. Professor Linda Bald, Chris Smith, virologist, thank you.
If you like this video, please a thumbs up. Subscribe to my channel, Son James. May the force be with you always. Wait, that's the knees and Bailey. Outweigh the knees for you. Thanks for watching. Bye.